So this morning, we heard about hope. And hope is a critical thing for all of us. And it doesn't matter where you are or what you're struggling with. I work with many, many nonprofits across the country, and it doesn't matter which one it is. I work with healthcare organizations with some really dramatic illnesses, with homeless shelters across the country, with animal welfare groups, with food banks, and I travel all over the country. And when I ask them, what is the number one message you're trying to convey today? It is we're trying to give hope. So that's what this weekend is about, amongst other things, but it is about hope. And how can we actually impact that and have an effect on hope? As Elizabeth shared with us this morning, that treating the symptoms isn't really changing the outcome. Treating the symptoms is a really good thing for those individuals who are in that moment. But if we are really going to make a change, we do have to go deeper, and we have to go to that systemic level. So now, as we come into our last session for this morning, before we have free time for the afternoon, we're going to start delving into the pillars that Elizabeth shared with us this morning. So without further ado, I'd like to introduce our first speaker. Deb O'Hara Rusckowski is a critical care nurse by training with a BSN, MBA, and a master's in theology with a concentration in bioethics. After working in healthcare and the private sector for 30-plus years, she founded Global Strategic Operatives, which trains healthcare systems to identify and respond to human trafficking. She is a delegate for the Order of Malta's mission at the United Nations, and created the first universal human trafficking standards and policies for the healthcare sector. Through Global Strategic Operatives, over 800,000 healthcare professionals have been trained domestically and internationally. She's married to Steve Rusckowski, and they now reside in New York City. Please join me in welcoming Deb O'Hara Rusckowski.
Thank you very, very much, Carla, for that kind introduction, and I'd like to extend a warm thanks to my friend Elizabeth, and who's so gracious in inviting me here to share with you a little bit more about this pillar. So, empowering the front lines, the Foundation United's first pillar of service is a call to battle. It truly is. For in the fight against sex trafficking, abuse, and exploitation, we are at war with a hidden, relentless enemy that will stop at nothing. The front lines in this struggle have several flashpoints, places where, by strengthening both offense and defense, we can prevent bad things from happening. The education system, it's the most universal of these fronts, with school the place, as early, I regret to say, as preschool, where abused kids are likely to show signs of trauma. These signs of trauma include an inability to learn, reluctance to engage, and a fear about going home. A teacher said, "I was stupid," one survivor recalled. "But I knew I wasn't. It's just that I was worried about what would happen again that night in my bedroom when my father came in." I can't imagine. I'm sure most of us can't. Because over 90% of the time, young people are harmed by someone they know, as Elizabeth was saying with the statistics, a family member or a family friend, or by someone they come to know. A trafficker who beguiles those through presence and promises, charm and lies, before subjecting them to horrific abuse that destroys the mind, body, and soul. One way the Foundation United addresses this is through Speak Up, a turnkey train-the-trainer model that provides schools with a top-down prevention approach, educating educators and students on how to stay safe and recognize those red flags, backed by evidence-based K-12 curriculum. Another front line involves law enforcement agencies, which play a pivotal role in the fight against sex trafficking and abuse. Unfortunately, many are hindered by budgetary constraints that limit special training. The result? Police aren't prepared to detect and respond to warning signs of exploitation. In response, the Foundation United created National Training Cadre, the NTC, providing human trafficking training to law officers at no cost. Experienced NTC trainers instruct about abuse and trafficking taking place on the dark web through cryptocurrency, familial trafficking, strategies for successful prosecution of predators, and more. I've been honored to get to know Alan, who's on our law enforcement NTC, and I'm looking forward to working with you closer. This is a very important sector that we have to focus on. And this brings us to foster care, with over 400,000 children in the U.S. alone. Statistics here are disturbing. 50% of human trafficking victims are involved in the child welfare system, while foster kids are 4 times more likely to be sexually abused as peers not in that setting. They can find help via Foundation United through their Cool Aunt series, created by Rachel Thomas. I know Rachel's here. I'd like to acknowledge you, Rachel. Can you stand up, please? Yes. Thank you, Rachel, and you'll hear more from Rachel later, but oh, are we fortunate and blessed to have you. And this Cool Aunt series, and yes, I say aunt, some say aunt, but it's an online resource accessible to thousands of high-risk youth through smart devices. Walking teens through the risk factors for trafficking, it gives them a chance to self-assess, and most impactfully, partnering them with a personal survivor mentor who can relate to them and guide them. The Cool Aunt team helps kids build a support system, take control of their future, develop confidence, and stay safe from abuse and exploitation. Called Powerful and Life-Saving by anti-trafficking experts, the series includes resources for caregivers, tweens, and teens alike. Empower the Front Lines also extends to healthcare, something I know a bit about after 30 plus years in the field as a critical care nurse. The experience led me to found Global Strategic Operatives for the Eradication of Human Trafficking. That was back in November 2018. The healthcare arm of the Foundation United. And GSO, as we fondly refer to, is focused on equipping the medical community to medically identify signs and symptoms of sex trafficking while teaching them how to assess and provide safety for their patients. This is an entirely new and needed layer of protection for victims of this crime. Since its start in 2018, Global Strategic Operatives we have trained over 800,000 healthcare providers worldwide. And it was through a hybrid of virtual and live presentations that was the train-the-trainer methodology. Using system-wide approach led by survivors and expert clinicians, we start at the highest levels of an organization. So when you get the CEO to buy in and make it part of their mission and strategy, that's when you accomplish that. And we targeted integrated delivery network systems, so it was hospitals with like 35, 40 hospitals. So once trained, the participants know how to confidently take action internally and through external partnerships to help young people in danger. Ladies and gentlemen, in sharing this all with you, I don't pretend that we can eliminate all evil. Only God has the power to do that. But I believe He is using us to be His hands and feet here on this earth to move the needle in eradicating these injustices. Make no mistake, the problem of abuse and exploitation is all around us. Just because it is hidden doesn't mean it's not there. And the problem will be that it'll get worse if society lets it. But we, all of us here, do have the power to make a massive difference in the fight against abuse and exploitation, right here this weekend through support for the Foundation United. A positive, proven, one-stop resource for anyone on the front lines who matters in the life of a child. So we can seize the initiative, to help parents protect their kids, to help kids protect themselves, show nurses and doctors what to look for, heighten the awareness among police, train teachers and social workers, and empower the front lines in a world united against abuse. Our next speaker knows about these issues through painful personal experience. A survivor of abuse and trafficking, her plight was often missed by people who didn't know what to look for. Hers is an amazing story of triumph over adversity, during which she not only made herself whole again, she now does the same for other survivors of abuse. She is a member of the Global Strategic Operatives team. She is empowering the front lines and sharing her story to raise awareness. She's passionate about connecting abuse survivors to the available resources, streamlining the process which was not done for her. I'd like you to welcome a courageous woman I'm proud to claim as a friend, colleague, and role model, Jenna McKay, which I'll give a little bit of background because I've had the honor to know her for several years and watch her grow to be who she is today. Jenna McKay is a survivor of human trafficking with an incredible life story she now shares through advocacy groups throughout the U.S. Jenna's extraordinary journey offers hope that inspires others through education and training. She continues to train hospital staff, law enforcement, and other first responders how to identify victims of sex trafficking and labor trafficking. Her personable keynote speaking engagements leave a notable impression among a variety of audience demographics, including the United Nations. In 2016, Jenna started the Jenna McKay Foundation to engage in a broader advocacy training model. Jenna has been interviewed on countless podcasts across the country and internationally, including Elizabeth Smart. She has written various articles for blogs and newspapers as well. She also consulted on the award-winning documentary Surviving Sex Trafficking. Jenna served on the board for the Worthy Ranch in Montana and Cycling for Change in New York. It is my utmost privilege and honor to ask Jenna McKay to come to the stage. Thank you.